Hi guys, this is the Common App that got me into Johns Hopkins and UMich for undergrad. I went to Johns Hopkins for undergrad. I went to my master's at UPenn, and now I've written hundreds of supplementals and Common App personal statements for all my customers, including you lovely people. Let's get right into it. Discuss an accomplishment, event, or realization that sparked a period of personal growth and a new understanding of yourself or others. Here's the thing, the prompt doesn't matter. It's fugazi. You could write about whatever you want for your personal statement as long as it's compelling, and then you can just retrofit the prompt to go for it. There's 7 different prompt options. You can find one that works. Anyways, let's get right into it. The familiar smoky odor of agarbatti, South Asian incense wafts my way as I enter Bohemian Cemetery funeral home yet again. So you got to situate the reader and show, not tell. Bring them right into your story as part of your hook. You could also use dialogue. That would also work. But don't just say oh, but I'm a pallbearer at the cemetery for, my religious services funeral committee. You actually have to just bring them right into it. Because eventually you're setting the scene to talk about your, experience, what you did or what happened to you. Reflect on how it shaped your mindset and what you did as a result. Like, what was your growth arc looking like? Make sure you're using some good vocab words and, situate them right into it. Anyways, without skipping a beat, I began assisting my fellow members of the Ismaili Muslim burial team, mostly men and women my parents' age, to prepare the hall for today's funeral ceremony. Individuals in white, which is the color traditionally worn to South Asian funerals, recite a congregational prayer in unison for the deceased individual even before the funeral ceremonies have officially commenced. So I'm bringing them into a little bit of cultural background so that they can understand where I'm coming from. Despite the echoing harmony, I managed to overhear some community members muttering softly about how Morteza, the deceased individual, became very sick towards the end of his life due to complications from his diabetes. So it's a little bit of foreshadowing here. When I applied to undergrad, I applied as pre-med. I wanted to go into genetics, down the pre-med route. And so this sort of indicates that that's my path. I'm setting a narrative for myself. By the way, your Common App should also support your extracurricular activities. They should be the same narrative. So if you're applying pre-med, make sure that, your supplemental essays, your Common App essays, and your extracurriculars all align on a pre-med track. Maybe you interned at a doctor's office. Maybe you did some bio research, something like that. Anyways, let me know if I'm talking too fast. I'll slow it down for the next video. But in the meantime, although I appreciate that participating in my community's burial team has forced me to confront my own mortality, I can't help but think of the many deaths that I've witnessed that could have been prevented or at the minimum delayed. Common yet chronic conditions such as hypertension and diabetes plague the South Asian community, so I've been exposed to them from childhood. But I began contemplating the topic more extensively after joining the burial team and witnessing the direct result of these illnesses. So I'm giving sort of a logos justification, which is just the high rate of these conditions in the South Asian community, and the pathos, the personal. I was in the burial team, so I witnessed it firsthand. It's not only the statistics, it's my experiences. So it's good to give multiple perspectives as to why you care about what you care about for your Common App essay. Anyways, where was I? Part of the issue is likely due to the diet and lifestyle habits we have brought with us from South Asia. But the other components are certainly poor health literacy and the financial burden that healthcare poses. So I'm bringing, multiple different perspectives. Like I said, continuing down that pathway. Many individuals in my community, they ration their healthcare, they cut pills, they even do some other alternatives because they often can't afford proper medical treatment. And it just goes to show why preventative care is so important. And I said, learning about the impact of these chronic conditions on people piqued my interest in the socioeconomic determinants of healthcare and in the issue of exceedingly high costs of healthcare. Eager to learn more about healthcare and the social factors that affect patient outcomes. By the way, this is me showing my growth arc. This is me showing how my experience shaped my goals going forward, which is what you should do in your Common App personal essay. I began volunteering and shadowing at Weiss Memorial Hospital in the emergency department. Numerous experiences with chronically ill patients who came in with acute exacerbations of their disease served to reinforce my curiosity and interest in this topic. I began to recognize the very real financial barriers that prevent patients from adhering to both medication regimens and to a healthy lifestyle in general. And then I talk about this one patient who I encountered who had diabetic ketoacidosis, and, he had to ration his medication across several days. And, so I talked about that troubled me, and I became passionate about learning more about what options exist to reduce the burden of healthcare costs that Americans face. So, again, my experiences shaping who I am, shaping my passions, shaping my goals. That's what you should talk about. Learning about the issues of healthcare costs and inaccessibility firsthand in the hospital and the burial team, as well as through coursework in AP Environmental Science, have piqued my interest in the socioeconomic aspects of healthcare. I now look to answer the question of how to make healthcare and prescription drugs more affordable in the U.S. I look forward to merging my interest in public policy and healthcare and university and hope to work on improving health literacy in general. So always talk about what you're going to bring forward to university, how you're going to impact, how your experiences and your mindset shift is going to impact what you do in their college, because they want you to look good to their college. They want you to bring positive recognition to their college. I hope I'm working on improving health literacy in general and for my community in particular. One step I have taken, always bring some evidence that you actually care. Don't just talk about it. Show like what you've done towards this goal is serving as a resource to families within my community within the area of education, leading ESL courses for the new immigrants, as well as spending time tutoring the school-aged children has been particularly gratifying for me. And then the button is like covering the rest of the text, so I can't read it, but you guys could read it and see how forward-looking the rest of this is. But yeah, and then I essentially, just talk about how I'm excited to increase my skills and help my community at large. Very forward-looking, nice end statement and conclusion. So yeah, that's the anatomy of a good personal statement. It got me into Johns Hopkins and UMich for undergrad, and I did a similar type of personal statement for my UPenn master's. If you need any help at all with your essays, DM me right now. We will take care of it. Everything will be perfect. I will make sure that I edit your draft to perfection. I write your essays. I do both of them. And then, you'll get in probably. I mean, it depends on your, extracurriculars, your test scores, your GPA, but I'll do whatever it takes.